Getty stock eating a handful of nuts twice a week can slash the risk of heart disease by almost a quarter. A study of over 200,000 people, many of whom were followed for more than 3 decades, found all types of the snack help prevent the world's biggest error. Regular snacking on walnuts, almonds, hazelnuts, cashews, pistachios, pecans and peanuts achieved dramatic results compared to those who rarely or never ate them. Those who ate any of these tree nuts 2 or more times a week were 23 and 15% less likely to develop coronary heart disease or cardiovascular disease, respectively. The same amount of peanuts, which strictly speaking are a legume, also reduced the risk of the conditions by 15 and 13%, respectively. Our findings support recommendations of increasing the intake of a variety of nuts, as part of healthy dietary patterns, to reduce the risk of chronic disease in the general populations. Dr. Marta Guashfair, nutritionist at Harvard University, eating walnuts 1 or more times per week reduced coronary heart disease and cardiovascular disease risk by 21 and 19%, respectively. Nuts have long been regarded as superfood, as they are high in antioxidants, proteins, nutrients, minerals and fiber. The latest study is the biggest and longest running of its kind. Along with heart disease, they have been found to protect against a host of serious illnesses including cancer, diabetes, respiratory conditions and dementia. Getty stock nuts have long been regarded as superfood, as they are high in antioxidants, proteins and nutrients. Lead author Dr. Marta Guashfair, a nutritionist at Harvard University in Boston, said our findings support recommendations of increasing the intake of a variety of nuts, as part of healthy dietary patterns, to reduce the risk of chronic disease in the general populations. Her large-scale analysis showed a consistent link between the quantities of nuts consumed and cardiovascular disease and coronary heart disease. Those who ate 5 or more servings of nuts a week had a 14% lower risk of cardiovascular disease and a 20% lower risk of coronary heart disease. The results were similar for tree nuts, which also include macadamias, Brazil nuts and chestnuts, and peanuts individually. Thursday, April 6, 2017. 10-step plan to eliminate your risk of heart disease. Eating peanuts and walnuts was also found to reduce the risk of stroke. The study, published in the Journal of the American College of Cardiology, said recent dietary recommendations have shifted towards including higher quantities of nuts. This is due to their unique nutritional composition, reducing risk factors for cardiovascular disease. Nuts were included because they have a similar fatty acid and nutrient profile. Over 210,000 female nurses and male health professionals in the U.S. were followed for up to 32 years, providing information about their medical history, lifestyle and illnesses via self-administered questionnaires every 2 years. Dr. Guashfair and colleagues identified 14,136 cases of major cardiovascular disease, along with 8,390 of coronary heart disease and 5,910 of stroke, some of which were fatal. Dr. Amelia Ros, of the Endocrinology and Nutrition Service at the hospital clinic in Barcelona, reviewed the results for the journal and said their consistency suggests nuts really do protect against heart 5 disease. He said ideally further investigations should test the effects of long-term consumption of nuts supplemented into the usual diet on hard cardiometabolic events. Getty stock: those who ate 5 servings of nuts a week had a 14% lower risk of cardiovascular disease. In the meantime, raw nuts, if possible unpeeled and otherwise unprocessed, may be considered as natural health capsules that can be easily incorporated into any heart protective diet to further cardiovascular well-being and promote healthy aging. Cardiovascular diseases are conditions such as heart disease and strokes which involve a reduced blood flow to the heart, brain or body due to a blockage or narrowing of the arteries. Coronary heart disease is when fatty substances in the walls of the arteries and affects 2.3 million people in Britain, causing 69,000 heart attacks each year. Heart disease remains the number 1 in the UK, with 160,000 people dying from it each year.